So as we talk about interventional, I've talked a lot about TMS or transcranial magnetic stimulation. The other really important interventional arm that we presently provide across all of our markets, or will be soon anyway, is a treatment called Spravato. It's actually a tweaked version of a compound called ketamine. Ketamine's been out for a number of years as a general anesthetic agent. It's been used in the animal population for years for anesthesia. And some very smart researchers stumbled upon the fact that if you were to give ketamine to someone with depression, they get better. And by the way, they get better very quickly. Since then, there's been a development of what's called the S enantiomer, or a piece of ketamine, which is called esketamine, and that is Spravato. Spravato does very much the same stuff, works through a very similar pathway as ketamine. And again, important to note, it works very quickly. So as we think about interventions, the other important thing to note is not only do they tend to be dramatically more effective statistically, especially if you've tried and failed two medications, certainly by your third and fourth and beyond, they also tend to work much more quickly than traditional services like therapy and medication. TMS itself tends to work within about 4 weeks, sometimes a little bit longer. We think about traditional medications needing 6 to 8 weeks or more. Ketamine and esketamine, or Spravato, works within hours. We truly can turn someone around, or we can truly create relief for someone with severe depression, PTSD, in hours. Some of the science would suggest literally within 4 hours, we can dramatically improve someone's mental health state and actually keep it there, and do that at similar rates to TMS, 65, 70+% effectiveness in individuals who, if I would have handed them a third or fourth medication, would be 15, 10, 7% effective. So as we think about having a toolkit and not just a hammer and nail, we think about interventional as an array of services, notably TMS and Spravato, both of which are highly effective, both of which work much quicker than traditional treatments, and both of which we offer as part of our continuum of care and our standard of care across our Transformations Care Network. One of the key differentiators between the interventional service lines of TMS versus Spravato, you may recall that TMS has fairly few side effects, and it is very focal and non-invasive in nature. Contrast that to Spravato, which actually comes with quite a lot of side effects, but just like it works very, very quickly, the side effects are also very, very transient, typically. Usually within 24 hours or a restful night's sleep. However, almost all of them within 2 hours of administration. The most common side effects for Spravato, and they are quite common, are sedation. Sedation occurs in about 50% of patients who receive it. And something called disassociation, or this out-of-body experience, which if you've had a history of trauma, you may have experienced on your own as part of your survival mechanism with that. But disassociation occurs actually quite frequently too, 60+% of the time. And so what I would urge you to do as part of your decision-making process, whether you are a provider or a patient, is to note how quickly these treatments work, how effective they are, and then the side effects associated, knowing that although TMS has very few and Spravato has quite a few that are actually quite frequent, noting again how quickly it works, but also how quickly those tend to resolve, and keeping in mind that the very common ones are sedation, dissociation, and some mild blood pressure issues. So as we talk about our standard of care at TCN, one of the things that we hold critically important is that we are not a hammer and nail. We do not go out looking for everyone having a certain diagnosis. We are not looking for providing the same exact care to every single person. We really do treat the patient as a unique individual, and we work together as a team to develop a treatment plan. What also creates that uniqueness for us is our ability to slot in things like psych testing, our ability to slide in things or offer options like TMS and Spravato. So although the majority of patients statistically will still benefit just fine with therapy services, plus or minus medications or vice versa, our ability to provide that whole array and continuum of care from therapy services, medication management services, to psych testing, to interventional like TMS and Spravato, allows us to create a unique patient experience and a unique patient outcome as compared to most places you would go receive mental health services.